Now, from the News Channel 5 network, this is Medical Mondays.
Hello, everyone. Glad you are with us. We are talking about something tonight that affects so many people, and that is chronic pain. And we are very happy to have with us someone who can answer your questions about this from the Nashville Pain and Wellness Center, Dr. Madhu Yelameli. Thank you, doctor, for being with us.
Thank you very much. Thanks for having me here. It's a pleasure.
What we want to do is just kind of give people a sense of this topic. It affects so many people. It's a difficult thing for people to get good information about. And that's what we want to do tonight, is just give good, solid information.
Yes.
And so we start with, what is chronic pain? When we talk about that, what is it?
Chronic pain is something, if you go by the definition, it is a pain that exists for more than 3 to 6 months. And any of the treatments that are typically done for such kind of pain have not worked. The pain has continued, and the patient has continued to complain of pain. And now we have done everything that can be curative, and right now we are left with no options. And you just call it a chronic pain and start managing that pain.
3 to 6 months, and this affects so many people. I mean, I know people that have felt like
Yes.
people don't understand them.
Mm-hmm.
They have this pain, they go to a doctor says, we don't know why you have this pain, and yet it persists. Is
Yes.
that something you see?
That's typically what happens, because when a patient develops pains, let's say you have back pain, and initially the back pain starts as an event, after an accident or after a fall or lifting something heavy. I'm just taking back pain as an example. This can happen with any other kind of pain. Now, that pain will go away after a few days or a couple of weeks or 3 weeks. The patient goes to the primary medical doctor, gets some treatment, or goes to a chiropractor, gets some manipulations done, or goes to the surgeon, has a surgery done, depending on the severity of the case. And then the pain goes away, but it can return later on when a similar event happens, when suddenly a patient has a trauma or gets rear-ended in the traffic or something. So the pain comes back. Now, over a period of time, chronic pain can develop in such patients too. Those who have acute episodes over a period of years, sometimes these episodes become more frequent and more severe. So this also can be called chronic pain, whereas this doesn't really fit into the definition of 3 to 6 months. This is over a period of years. The patient would have developed this pain. Some patients I have seen who have had 5 to 6 surgeries on their back, and each one would have helped the patient's pain for, let's say, 2 years, 3 years, 5 years. And then finally there comes a day when nothing is helping. The patient is still in pain. So this is also another kind of chronic pain which really does not fit into that definition of 3 to 6 months pain.
When we talk about pain management, how do you define that? Because there's all kinds of definitions swirling and thoughts that people have when they hear the term pain management. What is your definition?
Pain management, for me, pain management is trying to figure out what is causing pain. Is the first thing that matters most. Many times when we as pain physicians, we are trained to identify the different causes of pain, which a regular doctor may not be trained to do that. There are certain structures in the body that can cause pain that we are aware of. So we put these patients through a set of a thorough examination first, a physical examination. We touch the body where the pain is, and we run them through some investigations like scans and nerve condition studies and other investigations. And we try to come to a diagnosis first. We come to a possible, okay, this is the structure that is causing the pain. Then when we tell the patients, I mean, this is really amazing. When we tell the patients, look, I think this is where your pain is coming from, they feel so good that finally somebody could find the cause. Half their pain is already gone, because most of this time they were in the dark about what's going on here. I mean, I have so much pain, I go to the doctors, they say nothing is wrong. But as pain specialists, we are trained to do this. We can figure out, is it a neuropathy? Is it coming from a facet joint in the back? There are little joints in the spine called facet joints. Now these can get arthritic. And that can cause severe back pain, which a surgery might not have taken care of. A surgery won't take care of your arthritis in the back. There are so many other structures in the back. There is something called sacroiliac joint in the back. Now, that doesn't even show up any abnormalities on the MRI scan if you do an MRI. So we know how to subject the patient to tests that will tell us probably possible causes of pain.
Which is such an important part of the battle. Because if you know what is actually the cause of the pain, you can then begin to actually cure it. Treat it in a way. Treat it in a way that does more than mask it.
Correct.
Because that's the other thing that you hear happen a lot. That
correct.
Someone is in pain,
right.
and they go to a place and it's simply mask. And the root cause is never treated.
Never treated. So once we know where the pain is coming from, we start managing it. We may do certain tests, we may do certain injections, procedures, and we may subject them to more tests before figuring out where the pain is. So once it is figured out, we start treating them with different kinds of medications. There is a whole range of pain medications. Each pain medication works on a particular type of pain. There are non-steroidal anti-inflammatory drugs, which we know about, ibuprofen, naproxen. These drugs help with arthritic pain. There are neuropathic drugs like gabapentin or pregabalin. There are drugs which help certain other central pain syndromes like duloxetine. So, and there are muscle relaxants. And there are local anesthetics. So all these drugs, we may be using any of this or a combination of these drugs along with certain procedures to help manage this pain based on what the cause is. So chronic pain is quite prevalent in the world. Actually, recently there were some big studies that were done encompassing like several countries across the world. And they found that even conservatively, they have put the figure at 20 to 30% as the prevalence of chronic pain. So 20 to 30% of the population suffers from chronic pain. And there have been many studies in US too, done by very reliable organizations. That have shown that there's a big prevalence of pain. That is why we're setting out there to manage this problem. And of course, there still needs to be a lot of awareness that has to be built among the physicians and the public in general about this problem.
When you say awareness, what do you mean by that? You say even awareness among physicians.
Yes.
What do you mean?
We see all the time patients coming to us with chronic pain, but the physicians who have treated them prior to that may not have figured out where the pain is coming from. So many times, let us say you have a disc herniation and you go to the surgeon and you have back pain. So the disc is taken out and the bones are fused. Now, if you go back to the surgeon after a couple of years, I still have pain. Now you take an X-ray and everything looks good. The disc is not there. There is no problem as far as the X-ray goes or an MRI, repeat MRI goes, but still you're complaining of pain. So why is it so? The surgeon may not be able to figure out that, or a general physician, or let's say a specialist who has nothing to do with pain management, let's say an endocrinologist or some other specialist may not know exactly what the cause of this pain be. That doesn't mean that the patient does not have pain, or that doesn't mean that there are no specialists who can figure this out. What I want to say using this forum is that we are here. We will try our best as pain physicians to figure out why the patient is complaining of pain. Because we see pain patients suffering severe pain, just giving up on life. If the doctor says that I don't know where your pain is coming from, then the family and friends start doubting the pain, and they're asked to work. They're asked to continue to function in the family. They have to take care of the kids. They have to do the chores at home, or if they're working outside, they have to continue to work. The employer may not believe in your pain. The co-workers may not believe in your pain. So it becomes a big problem for the patient who has a genuine pain to function in the society. So it's extremely important that we tell the public, the physician, the medical faculty, the medical fraternity, and the public in general that yes, there are ways to figure out why there is pain. And there are people who are trained to do this. And
And that is, one more thing before we go to break. I mean, the other thing that people sometimes focus on is the whole aspect of addiction that is associated with pain management. What do you want people to know about that?
I feel in the field of chronic pain management, addiction has become a distraction. So the opioid addiction is just taking away all the attention from chronic pain management, which should be actually all this attention should be actually bestowed upon the pain patients who are suffering and not about addiction. And to discuss why this has happened, that probably will take several hours to discuss this in this forum. I mean, it's a very, very big problem. I totally understand that it's become a big social issue, and but I think right now things are being done, regulations are being put in place to control this epidemic of opioid abuse and addiction. And I do agree that pain management is partly responsible, or maybe to a great extent responsible for all this.
And it can be treated without that, obviously.
Yes.
All right, so we have to take a break. We have several calls.
Sure.
If you want to call, there's the number, 737 plus 737 7587. We will take a break and take your calls. We'll be back right after this.
Medical Mondays is brought to you